Initiative for Health Accountability and Transparency welcome you to CPD Academic course on Health Facility Management. This is Module 1 and is on management functions in health facilities. CPD Academy is the learning hub for health professionals. My name is MJ Abdullahi, your instructor for this course. The CPD program on Health Facility Management is made up of two modules. We have Module 1, which deals with the management functions in health facilities, and Module 2 on management of health resources. The course materials include the following: a graded pre-test quiz, which all participants must take before they proceed with this course. We also have the video and downloadable PowerPoint presentation, which provides more details. There is a graded course completion examination and suggested resources on health facility management. Those who choose to have course completion certificate and/or continuing medical education credits will need to achieve 75% pass and pay a little fees. Let us begin with Module 1, which is on management functions in health facilities. Let us begin by looking at the outline of the presentation. We'll begin with discussing different types of health facilities. We'll discuss health facility autonomy and health facility teams. We'll talk about management functions and speak specifically on leading a health team, on organizing a health team, and controlling and assessing a health team, and we will draw a brief conclusion. Looking at the learning objectives, at the end of this course, participants will be able to describe different types of health facilities. They will discuss autonomy of health facilities. They should be able to discuss health facility teams and explain the management functions, explain the roles and responsibility of health facility managers, and understand decision-making and proper management of health facilities resources for effective and efficient service delivery. Health facilities require resources such as money, equipment, materials, and techniques to get the work of healthcare delivery done. Many of these resources are scarce, implying that we have to make choice and set priorities. Most importantly, the role of sound management in healthcare has been emphasized in recent years as key to better health outcomes. Mere presence of health goods and services may not necessarily lead to desirable outcomes in the presence of poor management processes and practices. Effective health care delivery requires sound management teams with persons with both appropriate technical know-how and adequate skills and competencies in management practices. Unfortunately, many health management teams have very little capacity and little experience of fulfilling a management role. With better health facility management practices, technical efficiency, health outcomes, and impacts could be significantly improved, even within existing resource constraints. Let us look at the definition of a health facility. In general, a health facility is any location where healthcare is provided. Health facilities differ depending on level of care and scale of operation. The range and categories include small health posts, health clinics, and maternities. We have primary health care centers. We also have general hospitals. And let's not forget specialists and teaching hospitals, where we have elaborate emergency rooms and trauma and highly specialized centers. Health facility autonomy is important. Health facility is an organization, and the importance of autonomy cannot be emphasized in running effective management in any organization. Autonomy is one of the core principles of effective management of health facilities. It refers to independence in decision-making of health facilities with regards to use of health facility resources, pricing for goods and services, supply of inputs, management of human resources, and also financial management. However, there are a number of encumbrances to effective health facility autonomy, and the first has to do with undue interference, which is usually as a result of lack of trust from supervising level. Another encumbrance is monopoly of external service that is required by the facilities. For example, drug procurement. Usually, this is controlled by supervising level. However, it is important to understand the ways in which we can enhance and manage health facilities autonomy. The first thing is to strengthen the consumer voice. The health consumers are important, and when you create platform for them to air their voice and be heard, that helps us to enhance health facility autonomy. Another aspect has to do with effective regulation, planning, and quality assurance mechanism that is put in place by the supervising level. There could also be strict monitoring of results for output, quality, and feedback to enhance health facility autonomy. And lastly, but not the least, is creating competitive environment. Like every other organization, health facilities needs health team and health management and health leadership. With effective health team, together everybody in the team can achieve more. What then is a health team? Health team is defined as a group of people who work together and share common objectives, usually in the task of providing health care. The size and composition of a health team is determined by roles and responsibilities and also the level of operation. In large healthcare settings, it is an interdisciplinary team of healthcare professionals from diverse fields who work in a coordinated fashion towards a common goal for the patient. Then, why is it necessary to do health work in a team? We must understand that no one person can acquire all the necessary skills for all the tasks that need to be undertaken in health facility. Physicians, laboratory scientists, nurse midwives, pharmacists, all these people perform specific tasks, and no one person can do all this. There is also not enough time to do everything that must be done to accomplish all tasks in a limited time. It is also important to note that healthcare is a matter of life and death. Hence, responsiveness to the needs and demands of clients in a timely manner is often a matter of concern. Each member of health team contributes to healthcare delivery in accordance with his or her competence and skills, often in a coordinated manner. Every member of a health team has different work styles and expectations, and this must be managed effectively. Working in a team and being able to work together effectively and successfully require critical skills. Consequently, a variety of interpersonal skills and communications techniques are needed to ensure harmonious and high-performing teams. Team working requires understanding clearly what needs to be done by the team, and this starts with having clear logical objectives. It also includes making sure everyone clearly understands their roles and tasks, and it involves delegating tasks to people with the right skills and using people with different skills, e.g. creative organizers. Usually it is a multidisciplinary team in the healthcare sector. Taking a positive attitude to and learning from setbacks and from other people is also very important. Having people who are coordinated and also accept responsibility, and being comfortable with disagreement and seeing it as useful. This is the hallmark of health team. listening to others and giving constructive feedback if necessary, providing supportive, informal group atmosphere and use of humor as much as possible, and finally, creating enthusiasm and initiative to make things happen. These are all requirements for successful team working. Now, let us look at the head facility managers. Head facility manager refers to the head of a facility. He is the leader of health team. He has authority and makes decisions and sees that they are carried out. That is the hallmark of leadership. A leader has authority. The leader makes decisions, and not just making decisions, he also makes sure that the decision is carried out. He is responsible for the work the team undertakes, while the health workers in the team are responsible for the particular tasks of their individual works. It is important to understand team. The facility manager is responsible for the work the team undertakes, while the health workers in the team are responsible for the particular tasks of their individual jobs. It is important to understand this difference. In practical terms, when we talk about health facility management, we need to understand first what we need by management. And management is getting things done. It is a commitment to purposeful action. Emphasis often is on purposeful action, and is often written as management is saying what one wants to be done and then getting it done. That means it's commitment to purposeful action. In healthcare, management is concerned about productivity, which is often viewed in terms of service effectiveness and efficiency, responsiveness, utilization, outcome, and impact. Let us take a brainstorming session on management functions. Take a few seconds and note down in keywords or points on your understanding of management functions. Let us look at management functions. There are what we call core management functions, and there are 5 of them. We have planning, organizing, staffing, leading, and controlling. Let us start by looking at planning function. Health facility manager has responsibility for planning, which should include ensuring that the facility and every facility, however small, has its own mission, its goals, and objectives, as well as an action plan that details necessary actions, activities, and services that are to be delivered. It also includes ensuring that appropriate activities, services, and relevant courses of action, as well as the schedules, are clearly identified, and ensuring that decisions or commitment of human or material resources for implementation of scheduled activities are undertaken. For example, if you are looking at immunization services, you will make sure that all the inputs, including the vaccines, the cold chains, are all present. The injections materials are all available. That is commitment in terms of materials. You also have to ensure commitment in human or the workforces to make sure that those who are to provide these services are there. The next one is to look at organizing function. In order to discharge this function, the health facility manager is to ensure that there exists an intentional structure of roles. The emphasis here is intentional structure of roles, and this is filled by identifying all the activities and tasks necessary to accomplish goals and objectives, and also assigning people who are best suited or qualified to do the task with specific job roles. Now, the staffing function involves ensuring that staff positions in the health facility are filled by identifying appropriate personnel, taking inventory of available staff, and also ensuring that required personnel are deployed to the facility. And in terms of the leading function, It involves influencing people so that they will contribute to goals and objectives of the facilities. Most important problems in any organization arises from people, their desires, attitudes, and behaviors as individuals and in groups. Therefore, leading should involve motivation. It involves different leadership skills and approaches, and also communication. Let us not forget the controlling function, which involves monitoring, measuring, and correcting staff performance to ensure that activities conform to plans. It involves monitoring and measuring achievements, that is, performance, outcomes against goals and plans, noting where deviation from standard exists, and correcting these deviations from standards. Let us take a feedback. Did you correctly note down and understand the 5 management functions? If you do not, you'll need to go back to the last slide and listen again to the discussion. We'll start by discussing leading a team. Leading a team requires setting and sharing objectives and developing operational plan with the teams, motivating members, delegating authority and responsibility, and also using different styles of supervision as a means of effectively leading your team. Setting direction. Setting and sharing objectives and developing operational plan with team members is very, very important. To fulfill the objectives of an organization, those who work for the organization should know what its goals, its objectives, and schedule of activities are. It is important to emphasize this and for a leader to note this, because it's not uncommon to ask team members of what do they think is their goals, their objectives, and schedules of the activities. People are more ready to work towards goals, objectives, and schedules they have helped to set or share. It is important when you are leading a health team to understand and appreciate this particular issue. It is also important as part of leading a health team to motivate team members. What do you mean by motivation? Motivation is an inner impulse that induces a person to act in a certain way. And you must understand motivating factors for you to be able to motivate a person or a team. And motivating factors are things that encourage people to apply their ability and energy to work. These are called motivators. There are quite a number of motivating factors. It includes the value of work. People like to do useful and worthwhile things if they understand the value of what they are doing. There is also the issue of recognition. People like to be recognized and would like others to know of their success. So good leaders acknowledge the success and may even publicize it. There is the issue of achievement. Everybody or most people like to succeed, and their satisfaction is in getting things done well. Those achievement is extremely important to the individual, and good team leaders help people to achieve work objectives. There is the issue of an advancement, and the team leader should encourage people to increase their knowledge and skills so that they become ready for promotion, because some people prefer recognition that comes in a tangible form, such as an increase in salary or more responsibility or advancement to higher level. Let's not forget responsibility. Most people welcome responsibility, even though some people fear it. A leader can easily destroy or at least reduce staff members' sense of responsibility by taking decisions for them. A good leader takes responsibility to increase a subordinate's sense of responsibility for work rather than to diminish it by petty criticisms. There is the aspect of self-improvement. Many people want opportunity to develop themselves. Team leaders can help their health workers take such opportunities by providing them learning materials and challenging them with questions at work, and also giving them high quality supervision. Now, it is also important for leaders or managers who are leading health team to also understand and acknowledge that there are demotivating factors. Managers should avoid things that make people displeased with their work. These are called dissatisfiers, or what we call the demotivating factors. And demotivating factors, let's take a brainstorming session on it. Take a few seconds and note down in keywords or points on your understanding of key demotivating factors. The key factors to look at when you are looking at the issues of demotivation starts with inefficient administration. People like to work under a leader or manager that is both efficient and just. Managers who fail in their administrative duties cause serious dissatisfaction and discourage their staff. So efficient administration is a very key important factor that motivates a team. There is also incompetent supervision. The role of supervision in leading a health team cannot be overemphasized. Leaders and managers are expected to be technically competent. They must be thoroughly familiar with the details of their work they are supervising. There is poor personal relations, is very important. People expect to be treated fairly. People like to be consulted about their work. He never tells us anything is a common complaint, and it is an indication of poor personal relationships. We can look at the other one that has to do with poor leadership qualities. Leaders and managers have two forms of authority, that of their position and that of their person. Without the personal authority that comes from integrity, fairness, and a thorough understanding of the work, the authority of the position of leader will not impress those who are led. Low pay, very important. Salary is satisfactory when the workers get what they expect and what is generally regarded as being fair. A poor salary has a negative effect. Finally, let us look at bad working conditions. A bad working condition causes dissatisfaction. There is no doubt about it. A good leader must make sure that conditions of work permit staff to do their best work. Inspire members of the health team by example and effort to do their best in the difficult circumstances. Let us take a feedback. Did you correctly note down and understand any of the 6 demotivating factors that we have discussed? You may wish to reverse back to see some of these factors once again. Let us look at delegation of authority and responsibility. A leader of a team is responsible for the work the team undertakes, while the health worker in the team are responsible for the particular tasks of their individual works. People who can make decisions and see that they are carried out have authority. One way of using authority is to delegate that authority. Delegation means to give another person the power to take decisions on your behalf. It is very, very important that health team managers understand this and use it effectively in the right manner. Delegation has a number of advantages. It saves time for other duties. A manager or leader cannot do everything. It saves long delays that occur when awaiting decisions from a distant high-level authority. Health workers who make decisions on their own enjoy their work more and become more knowledgeable and skillful, and it's important to understand this. However, delegation also has a number of disadvantages. Wrong decisions may be made and work may not be done or may not even be done well. A leader may improperly pass all the work to the team members, leaving very little more for him or herself to do. A leader may delegate decisions to people with insufficient experience, and if not properly done and for a good reason, can result to overloading a subordinate with responsibilities. So delegation should not be just a way for the team leader to shy away from his or her responsibilities. or just to dump responsibility on the subordinates. There are specific rules for delegating authority and responsibility. It must be clear about exactly what is delegated. Select the person who you are sure can do the work. Explain to others that you have delegated work to so person and the work itself. Do not interfere unless asked to, and prepared for some mistakes if you are delegating. Give support as needed and follow up the progress of work. These are all important issues that those who are leading a health team should consider when they are delegating authority and responsibility. There is also a format that is often used or can be used for effective delegation. It's a table that has to do with the current tasks, current education and skills, tasks to be delegated, health worker who could be trained to do this for me. Usually before a leader takes decision about delegation, he should also be familiar with this tool. Leading a health team requires effective supervision, and there are different styles of supervision. Research shows that leadership styles are deeply tied to workplace outcomes. The primary objective of supervision is to help work team achieve optimal results. Your supervisory style says a lot about your approach to leading a team, directing, managing, motivating, communicating with team members. How controlling are you, and how much input you allow into your decision-making process. These are very, very important. Organizing a health team, apart from leading a health team, is another core management function, and it requires job descriptions. You require to have norms and standards. You also require to coordinate various activities and tasks of the team, communicate effectively, prepare and conduct meetings, and also training as important. So you must be able to manage in-service training at your level. Let us look at using job description, norms, and standards to help to guide work organization. First, distribution of tasks among the members of a team is one of the manager's most important functions. Job descriptions are one means of helping to distribute tasks among health teams. When work is distributed unfairly, it causes dissatisfaction and sometimes it causes quarreling. Leaders, those who are leading health teams, must understand and work with this in line with this principle. Work should be arranged in such a way that team members use their individual skills and talents. By proper organization, work can be fairly distributed so that there is no overwork or underwork, but all team members carry equal workloads as much as possible based on their skills and competencies. Let's look at an example of job description. You need to put a job title, you need to put the date, you need to put the name, job summary, and also look at the duties. You must also put the qualification, and then prospects of promotion to senior positions or something like that. And then you must also not forget appraisals and annual increments and promotion, which will be dependent on the performance appraisal. These are all things that we need to have for specific health worker that works in a team. Let's also note that the use of norms and standards is very important in organizing a health team. There must be set norms and standards of work, of performance, of productivity at every management level for comparing achievements with targets. While a job description is an instrument of organization which states everything a health worker is expected to do, a job description does not show how much a health worker must do or how well he must do that. It is the norms and standards that translate health objectives and targets of health team to amounts of work and quality of care expected of each health worker. As part of organizing a health team, you need to coordinate activities and tasks of a team. Coordinating activities or group of activities to bring them into proper relation with each other. Coordination ensures that everything that needs to be done is done and that no two people are trying to do the same thing. Very important. Coordination is the means of distributing authority, providing channels of communication, arranging the work so that the right things are done in the right place, at the right time, in the right way, by the right people. Very important to understand this third aspect of coordination. When activity is coordinated, everything works well. A coordinated activity is orderly, is harmonious, is efficient, and is also successful. When an activity is not coordinated, it is liable to fail in its objective. An uncoordinated activity is disorderly, is discordant, is inefficient, and often unsuccessful. Let's not forget that coordination helps work to progress smoothly. To make coordination effective, 7 well-recognized principles must be applied. It starts with objective. The objective of each group of tasks must contribute to the objective of the organization as a whole. Then the definition. Each group of tasks must be clearly defined so that everyone knows exactly what the task is or what the tasks are. There also ought to be a command. Each group of tasks must have one person in charge, and all concerned must know who this person is. Let's not also forget responsibility. The person in charge of a team is responsible for the performance of members of the team. There is also authority. Each person responsible for a group of tasks must have authority equal to the responsibility that is expected of him. There should be span of control. No person in charge of a group of tasks should be expected to control more than 6 to 10 other people. And finally, there is the issue of balance. The person in charge of several groups must see that the group's balance, for instance, case finding, must not be so extensive that more cases of disease are found more than that can be treated. It's important to understand these 7 principles which we must clearly appreciate when we are coordinating and expect to coordinate effectively. Let us look at the use of coordinating checklists to enhance effective coordination. A health leader or manager responsible for any action will find it useful to apply what we call a coordinating checklist. A coordinating checklist highlights what is to be done, where will the action take place, when will the action take place, what equipment or materials are needed, and how will the action be arranged. Coordinating people. Which members of the health team will take part, who outside the health team will take part, who will do what, that is the people, and who will lead. We have mentioned of a command in the last earlier slides. Then you must also ensure coordinating information. Is all necessary information available? Has the information been communicated? Looking at communicating effectively with the team. Successful teamwork depends upon good communication with the team. So communication is very important. And the communication we all know has 2 elements, sending and receiving. When this message that is sent is not received, communication has not taken place. Therefore, the team leader should always use some means of checking that the intended effect have taken place. It is common experience that personal relationships within a team can be difficult if communication is poor. Difficulties are often caused or made worse by poor communication within the team and between the leader and also the team members. The team leader should therefore pay special attention to the quality of team relations and of communications as a means of maintaining good relationships. All team members should be free to express and explain their views and should be encouraged to do so. These are very important and are necessary prerequisites for effective communication. Conducting meetings is also very important as part of organizing. Meetings are a necessary part of health teams at all levels. They take place virtually every day. There are also regular meetings of a health team. Sometimes there are committee meetings to make decisions on a new project or discussion to learn new skills and new approaches. When preparing for a meeting, it is useful to check the following items: purpose of the meeting, main subject matter, the type of meeting, size of the meeting, place, time, and duration of the meeting, and who is convening and organizing the meeting. Announcing information about the meeting is also very important. Good communication is key to success of any meeting. A good meeting is equally a successful communication. Training of staff. Training is a management responsibility. Leaders and managers use training as a means of making the best use of human resources of the health system. The quality of healthcare depends greatly upon the personnel who are trained in their different roles in health service delivery. A team manager or leader wants to have the best possible team of health workers skilled at their work. Training is used to make sure that each member of a team knows and can play his or her role effectively in order to achieve the goals of the health system. Training is used to maintain and improve the competence of the health team to allow the members perform optimally. Training of health teams serves the purposes of implementing health policy and policy changes, particularly at a higher level, extending the scope of healthcare, improving and maintaining the quality of healthcare, solving or reducing the health problems of a community. Very, very important focus of training. Training enables members of health team maintain a positive attitude towards their work. Training also enables members of health team know what they must achieve and have the abilities to achieve. Let us look at controlling and assessing a health team. Remember, we talked about leading a health team, and we talked about organizing a health team, and now we are looking at controlling and assessing a health team. Control measures guide health work and they ensure minimum standards are attained. Control measures are necessary to ensure that work is done according to objectives set and the activities planned within the time allocated and with the resources that is provided. It also enables leaders, managers to recognize deficiencies in health workers' abilities, knowledge, and understanding, and most importantly, to also arrange for appropriate training. And it enables supervisors to recognize and reward good work and to recognize staff suitable for promotion and advanced training. It enables management to ensure that the resources provided for work are adequate and are being properly used. And finally, enable management to determine the causes of work deficiency. Without effective controlling and assessing, certainly this wouldn't be possible. Good control should be timely. To maintain work standards, control measures must be taken at the right times. It must be simple. Control measures must be simple, otherwise they may take too long to apply and to produce the intended effect. They must be minimal. Control measures should be as few as possible, few as needed to ensure that work is done and standards are maintained, and they must also be flexible. Controls that are too rigid may be self-defeating. Staff will try to evade or circumvent them. Let us look at the various means of control. First, like we said, you can use instructions. Common instructions include job description, set of objectives and targets, which must be clear and circulated. Instructions must be clear enough to be understood by all concerned. Instructions must be stated in such a way that results can easily be assessed. The other one has to do with using work schedules. A work schedule shows what a worker or team of workers is to do, the day and time when it is to be done. They let the team leader know what the team is doing on a particular day or at a particular time, and also enables individual health workers to make the best use of their time. The third aspect of control has to do with supervisory visits. In supervision, nothing can take the place of visits by the team leader to health workers at their place of work. Supervisory visits assures health workers that the team leader is someone to whom they can turn for help whenever the need arises. Supervisory visits provide an excellent opportunity for the exchange of ideas and also for in-service training. Let's also not forget that supervisory visits gives the supervisor a chance to listen to health workers, to hear about their problems and their ideas for improving their work, and to assess the degree to which they are aware of the objectives and targets of their health program. During supervisory visits, health workers should be asked what program objectives they are working towards and what targets they are aiming at. There should be a checklist of what to look for. And finally, we are looking at assessing work performance as a means of control. Assessment is done by the team leader to determine the progress made towards achieving work targets. It must be based on clear statements of objectives and targets that have been laid down in job descriptions, or they may be specified instructions during training or on job orientation. An important aspect of assessing is to help people discover and make the most of their strengths and correct or minimize their weaknesses. The immediate supervisor who sees the health worker most often is the best person to make the performance assessment. It is necessary to have checklists for assessing work performance. These are the 4 methods of control which every leader or a manager should appreciate and know how to use these control tools. Records and reports are another important tools for controlling and assessing. What are records? Records consist of the information kept in the health unit about the work of the unit. This with individual patients, health conditions in the community, and as well as information or administrative matters such as staff equipment and supplies. Records are usually written information kept in notebooks or files. They may also be kept on tapes or they may be computerized. Records are the administration's memory and an important tool in controlling and assessing work. Records help us to learn, understand what is taking place, make effective decisions, and assess progress towards goals. Records should be accurate, they should be accessible, they should be available when needed, and contain information that is useful to management. The report aspects. What are reports? Reports are the information communicated to other levels of health service. They are also an important management tool for influencing future action. It is often found convenient to have reporting forms printed and distributed in advance to health units and centers, again with the aim of standardizing information. Health staff must be trained to prepare their reports according to the instructions given by the health services. Those who make written reports should keep copies of them themselves in the facility. Let us draw conclusion from the presentations and discourse in general. The role of sound management in healthcare has been emphasized in recent years as a key to better health outcomes. Health facilities require resources such as money, equipment, materials, and techniques to operate effectively and get the work of healthcare delivery done. These resources are limited, like we said earlier, they are scarce, implying that we often have to make choice, and in making choice, we will also have to set priorities. Efficient management of available resources will require persons with appropriate know-how, skills, and competencies in management practices to achieve set health goals. Unfortunately, many health management teams have very limited capacity and little experience of fulfilling a management role. With better health facility management practices, technical efficiency, health outcomes, and impacts could be improved significantly even within the existing resource constraints. A number of resource materials are listed here for further reading on health facility management. You may need to explore others outside this list to give you a good insight and a good understanding, improve your skills and competencies in health facility management. You may wish to join our CPD Academy Learning Network to ask questions, share ideas, and make comments. To ask questions, share ideas, and make comments, mail us at iheartnigeria@gmail.com.